Hello, everyone. Welcome to the Healthcare Inspired Podcast. My name is Jennifer McNamara, and I am your host. I am looking forward to an amazing show today. I want to bring on the stage my amazing co-host, Maya Turner.
Hi,
Welcome to the
hello
show,
everybody.
Maya.
Hello,
How are
beautiful.
you? Oh my goodness. I'm so happy you're here.
Same.
So exciting. So exciting. So we have a great show today, and I'm really excited to talk about this episode. I know you and I had this conversation with a group of people recently on the importance of compliance officers.
Yeah.
And we work in compliance. We're like unofficial compliance officers to a lot of organizations, right? So yeah. So I want to do something before we get started. A lot of people ask me what I do in my spare time, and then I think, like, do I have any spare time these days? I mean, what's that
Right.
like? But I'm working on trying to kind of reorganize my life lately
Yeah.
because I want to be able to give my all to my clients, but I can't give my all because you can't give your all to multiple things, right?
Right. And you can't give
So
your all to yourself either, right? You can't give all to anybody if you don't give
exactly.
your all to yourself. So yes, for sure.
Yeah. So I meditated on that recently, that to give your all to something, you have to completely devote yourself to it.
Yeah.
And while some clients might think that you should devote every waking minute to them, it is just not possible. So I am reorganizing my life to where not really I come first, but my family comes first. The things I care about the most come first.
Yeah.
And so I'm changing my schedule, changing the way that I approach my work. And I think it's kind of a healthier way to think about life.
Absolutely. Mm-hmm.
And so for those of you out there that are struggling with that too, I'm not going to say it's easy, because it is not when you've done things one way so long. But one of the things I've never really done, and a lot of my family, they find therapy in reading a book. And
Yeah.
so I've never been a book reader necessarily. I mean, I read the Bible. I think that's important.
Right.
But outside of that, I've never been like a secular book reader. So years ago, when the Hunger Games series was out, everyone's like, you got to read the books. And I'm like, I'll just watch the movie. It's easier. And so before the third movie came out, I bought that book, and I was okay, before this next one comes out, I'm going to read it so I can like get the behind the scenes stuff that they don't really show in the movie. So it took forever. I could not get it finished, and the movie came out, and I was like, I'm just going to watch the movie. So
Yeah.
I read
Same.
like 2/3 of the book. So I didn't know what happens in the book at the end. So like, yeah, it was a surprise for me because I didn't know what was going to happen. But anyways, so I find myself that to start reading again, I have to read a book that I've already seen the movie so that I can get myself in the habit of reading again, right? So one of my favorite series is the John Grisham. I know a lot of people know that series, and I haven't really seen many lately, obviously, but
Right.
years ago in the 90s, it was a really popular series. So when I was in 10th grade, I read one of their books. We had like a third hour where we would read. Had to read for 15 minutes. That was like a requirement. Everybody had to read for 15 minutes, do whatever classroom you were in. They stopped everything at like this time. I think it was like 10 o'clock. Everybody was stopped wherever they were, and they read for 15 minutes. It was a cool thing, I think, that they
That's
did
nice.
in
That's you
school
do
to
that
get people to read.
now.
Yeah, they
Yeah.
really should. So it was a John Grisham book. But my favorite book is The Pelican Brief. So, or I guess a movie, but I want to read it. I bought this at like a flea market several years ago. And so I want to actually read it.
Mm-hmm. I did that with
Because
him.
so I want to read it and kind of get the ins and outs of I don't know, like therapy. Just, I think it's therapeutic to get a real book out and read it.
I don't know. The final rule is, as long as the final rule is, I don't know if I have time to read any
I know, right? Well, girl, let's go into the show. So let's officially talk about partnering in compliance, partners in compliance. We're excited to talk today. I think it's important that we understand the compliance officer's role. And again, if you haven't done so, I encourage you to get out there and look at the official compliance guidance document from the OIG that came out several months last year, and make sure you're. There's a lot of other documents that they are revamping, so to speak, that are kind of coming out. So stay tuned for those things. Always have the OIG on your radar, what is going on and what they have on their website. Always have it, at your fingertips. But it is an element. It's number 2. It's the second element. And let's talk about this concept. A lot of organizations, we work with small practices. We also work with mid to large size practices, and we both work with hospitals. So let's talk about the small practice versus the mid to large size practice, 5-10 physicians or more. And there is a compliance officer, and then some organizations, they have a compliance committee. So kind of the concept, they're why do you need a compliance officer first? And then where does the committee come in?
I think when we were talking about a compliance officer is someone that you go to when there is an identified risk, or if there's a concern about risk. And the compliance officer should be the main person at the office to trust for those types of things. But then when you have a committee, the committee talks about issues and how to address the issues that are related to risk. And so the committee should be consistent of everyone who are stakeholders regarding the risk. And so when you have the compliance officer, they're the mainstay of concern. The committee is to discuss the concern and how to address it and what's happening regarding it. So it's a very, very collaborative effort, and it should be fluid, right? And then the focus of the resolve should also be consistent, not like somebody is aware of it and then it just falls off. So, in my experience with both, I think, there has to be a general concern, and a lot of compliance departments have legal attached to them. Some of them don't. And so when you have legal attached to them, it becomes more aggressive. But when you don't, then you have to get somebody to buy in. So it becomes really a challenge if you're not connected with legal, which I don't understand why some compliance offices, compliance plans or organizations don't have that. That just doesn't make any sense to me. But when I worked in compliance with my larger organization, we were tied to legal, and that was important.
Right, exactly. And a lot of compliance officer roles, you'll look at them online if they are advertising for someone to be the compliance officer. They a lot of times want a certain degree, like a healthcare or maybe a legal background, because you do have to understand the laws that go into complying with. You have to comply with, right? So those are things that we think of. You got to comply with these things. So at the end of the day, we have to understand how important this role is. But I also want to talk about respect, because when you're new to healthcare, I was new to the medical practice and healthcare relatively a few years, and I didn't really understand the role of compliance yet in my career. It wasn't explained to me very well, I think, early on. And so then I know, right? Who really knows it? So when I think about, they would say, okay, this is the compliance team. They're going to come in. They just make the surprise visits, right? They're not going to announce themselves, because then you're going to they can't really tell what's really going on. So they just surprise you, right? Which is fine. But if you're doing the right thing, you shouldn't worry about it. But you would get in the habit, right? For me, once I realized that this is real and it's affecting my job, but it's also affecting, it's an important thing. I became in the habit of, okay, when I leave my desk, I'm going to make sure that everything is secure. I lock my computer. I turn over papers that anyone could walk by and see. They don't have a business need to see. And it became my whole way of doing things. We have gotten away mindset in healthcare.
Yes. I think,
And
it's really
yeah.
interesting though. Yeah. Go ahead. I'm sorry.
No, you're fine. I was going to say it's interesting how when you walk into a medical office today, when we compare that to like maybe the days 10, 15 years ago, like where everyone was really doing this well. And we still had EMR systems, electronic systems back then, where the chart was, up on the screen, and we still had paper. And we still have paper today. But the way that practices work, they either say they don't have time to be compliant, or they're just not given the proper training to be compliant.
Yeah. And I think it's the latter, right? I think it's the latter because the training is not important. But I can't tell you how many cases where I've seen where our, the legal department at my old organization found like garbage, patient sensitive information in a container, a large container. So there are certain things that need to happen when there's a breach. And when the breach occurs, and medical offices need to be aware, you can't just throw patient related information in a public receptacle. You have to put it in a shredder, and that shredder needs to be sent, and it needs to be held on for at a specific place for a specific amount of time. So you have all of these little nuances that are practical for everyday workflows, but the sensitivity regarding the information that everybody touches needs to be emphasized on the importance of the protected health information. And I don't think anyone realizes that when you throw a patient's information with their birth date, their social security number in the open garbage and not in the shredder bin, that's a violation. And again, because the practice is not dedicated, they're trying to keep up with the flow of the patients. Well, what if the patient was intentional with trying to find that information and then identity theft occurs as a result of that? Was that information protected? And it wasn't. So you got to really keep in mind that the practicality of it all is that we touch it every day. How we dispose or how we protect that information is going to be key.
Absolutely. And so when I think about, like, I had this experience, I always go back to this one experience that happened in one of the offices I was in early on. The nurse, she was a great nurse. I want to say we didn't always get along. Our personalities clashed a little bit, but overall, she was a great employee. The doctor loved her. She was a great nurse. I mean, she did her job, right? But she made a mistake and it cost her job. And I use this as an example because she was in tears. She felt horrible. And I saw a real human response from her. And it made me feel just horrible inside. I felt so deeply for her because we had this thing called Tiger Text, in the hospital that was not really utilized by everyone when it should have been. And so, physicians are like, just text me the information. I was like, and I would have to, in some cases, be like, I can't do that. Right. I don't have access to Tiger Text. I can't send you that. And so, but she was just like stressed out. So she just texted him, but she didn't use Tiger Text. She used her actual phone and she sent it to the wrong phone number. Yeah. That's why we have Tiger Text, because we're human. We're going to maybe click the wrong number in our phone and I don't know what the deal is. But anyway, so this happened. So they had to go find out, you have to take there's a breach, right? So you have to go make sure you address it. The office manager had to take care of that and make sure, but then corrective action had to be made. And so if you're going to be attending the compliance seminar on December 7th, you're going to find my session is the last one, element number 7. Addressing compliance issues with swift corrective action. So we're going to discuss how you need to be swift about your corrective action.
And consistent.
It's hard one. It's a hard
Yeah.
one because
Yeah.
you have people these days, we're so overworked, we have staffing issues. The last thing you want to do is have to fire somebody and
Yeah.
lose them in your organization.
Right.
They're maybe a great employee, but they have done something that is going to affect the organization financially and then also reputationally.
Yeah. Yeah. And I think, like you said, you hit the nail on the head. I think bandwidth is also an issue. Bandwidth, stress, anxiety, dealing with the workflow, dealing with the patients. But at the end of the day, compliance is about being mindful, right? Compliance is about being cognizant of what you're dealing with on a day-to-day basis. So regardless of the amount of stress that you're dealing with, you have to know that compliance should be number one, right? And that nothing should be exposed, because when patients' information is exposed, you cause the organization more money than what you realize just by that one little exposure, that one little text, because you have to identify people who are notified in the breach. You have to send a public notice, and then you have to do corrective action. So all of those things that are related to that cost money. So if you think about that and how that one little thing, oh, I'm just going to take a peek. Don't do that. Because if you do, you're going to cause more of a ripple effect than you probably never thought that people would even pay attention to. So I totally agree that, bandwidth is an issue, but don't let bandwidth, I mean, just like when people are slow on the highway, you can't go any faster. you still are stuck in traffic. So, but you're still behind the wheel. So you still have to know where you're going. You still have to drive. But at the end of the day, it's the same concept. You have to still keep in mind that compliance is always number one.
Yes, and we do have compliance officers that are hired to be the compliance officer that really don't have the skill set or the personality to be a compliance officer. And I feel bad for them because they may have thought initially when they're asked to be the compliance officer for an organization, maybe they were just asked to do it. And they really didn't have the
Training,
the shops to get it done. Office manager. Sometimes you're thrown into that position because you were asked to be the compliance officer, you're asked to be the manager, and you're really not ready for it, but you don't want to lose your job and you want to keep going. But you're like, do I really want this role? Do I understand all that's involved in this role?
And wait, but what's the key factor is the compliance officer has to be compliant. Hello. So you're just like,
Yes.
If there's going to be a designation of a compliance person, or they don't necessarily have to be an officer, but they need to be a person of compliance, right? They could be designated as the notification person. I mean, let's just keep it real. A lot of times people don't understand what it means to be compliant. So if once that designation is made, give them training so that they know what they're dealing with. It should never be an issue of bandwidth, because the goal of the compliance person, the compliance officer, is to maintain compliance. If they don't know what compliance is, then we're back at square one, as if the office doesn't have anything to go to for compliance issues. So regardless of the size of the office, regardless of the situation, once a person is designated, they need to be trained. And they need to know what compliance is, regardless if they want to or not. If you designated, you're going to take this class. I don't care what you say, you're going to take the class. I'm just saying.
I agree. So let's talk about training, because the office manager should be interested in their staff getting proper training. And who better to identify proper needs for training than the compliance officer? Because most of the time they have they have the full picture as to each role, who needs to have what kind of training, or they should know as a compliance officer. The physician teams, the non-physician teams, the registration people, the billers and coders, everyone has their own type of role specific training. And you have the general compliance training you have to have every year. You have to understand HIPAA, you have to go through safety, you have to do all that. But behind the scenes, there's things that are unique for each role. So let's, for instance, talk about our billers and coders, because we always talk about them, and we are billers and coders, and that's where we tend to talk about the ones that actually are responsible for bringing in the money, right? Let's be real. Those are the ones that actually bring in the money. And so they have to have their own role specific training, right? They have to understand modifiers. They have to understand the insurance process. Both teams should know that equally. I'm not going to lie. I'm tired of the silos that they put these people in. You're doing your organization no service by keeping your coders over here and your billers over here. It doesn't take much, maybe once a month. Give them some role specific training, but do some cross training. Make sure that all the teams interconnect and talk to each other. So they can learn from each other. Because if you have one coder in the organization and they get hit by a bus, what are you going to do? There needs to be some documentation somewhere of how to do their job, right? I mean, it's true.
Yeah.
It happens all the time. Like, how are they going to take a vacation and kind of de-stress theirselves and get the vacation they need if they're always worried about who's going to do my job if I'm gone? I can't leave because nobody knows how to do this, right? So make sure that they have that, and regular training. And it's not just annual training, it's ongoing. So make sure you have a system in place where every month there is some kind of education email blast, or maybe you send them to a course annually that they need for your specialty or your organization. Get them resources. So if there's updates to the OIG policy, updates at CMS, make sure that they have that information in their inbox, and that the compliance officer should be responsible and they should know what's coming down the pike before it happens. If they don't, then maybe they need to be trained as a compliance officer. And there is training available for compliance officers as well. So collaboration is the name of the game. So office managers are important to the organization. They keep things running. Compliance officers are just as important. This is any other role in the organization. I'm tired of hearing the back talk and the negative stuff we hear about compliance officers. I was never one, but I always respected them, and I really appreciate what they do every day, because I do actually help organizations with compliance, and I help them identify the proper compliance protocols. And when I talk to some compliance officers in the organization, they do share with me that they do feel underappreciated.
Yeah.
They feel like the Mikeys of the organization, right?
Yes. Yeah.
So it's like, yeah.
No, I was just going to say that I've been a part of many conversations where the culture of the compliance officer is always devalued. And it's part of a stigma, if you will, regarding the compliance officer, because the compliance officer is known as the tattletale. They're not the tattletale. They're trying to keep you from being, they're trying to prevent from being the tattletale. Because if you're compliant and there's a culture of compliance, the compliance officer doesn't have to tell anybody anything because you're being compliant. And the culture is, when I worked in the compliance department, I always described the compliance team as the cool cousin with the 6-pack of beer, right? That comes to the party, who is, what's the word I'm looking for? When the last beer is gone. So when you think about that piece, and when you think about compliance as a whole, it's about the culture, right? And it's about appreciating what is being done to prevent situations, to prevent money. And I remember seeing on Facebook a sweatshirt that said compliance officers are for compliance for the ungrateful, for people who are ungrateful. So when you think about that and you think about the role of compliance and the role of compliance, it's not necessarily about what am I saying? It's not necessarily about what we do, is what we prevent. And I think if you think of it that way, it becomes more appreciative, because you're not necessarily seeing anything. If you don't see anybody telling, then everybody's doing their job. But if they're not, then what are we really saying, and what type of culture are we supporting here?
Right. And, every organization has to decide what kind of culture they want for their organization. You can't look at the practice down the street and say, we want to be like them when you've never
Right.
worked there and you don't know what the culture is actually like. Maybe they
Yeah.
are bringing in lots of revenue, but do you know how they're doing that? Maybe they don't have a good compliance culture. Maybe they're
Right.
successful because they're breaking the law and they don't even know that they're doing that, right? So, I mean, don't go by how successful another practice is because they may not be doing things right. So
Right.
decide for yourself that you want a compliant culture and the culture you want, right?
Right.
So there are a lot of things that go into that. And some of the challenges that I'm going to be real here, some of the challenges that compliance officers have are usually with physicians. And I love my physicians, but they live in a different world than
Yeah.
the business staff does.
Yeah.
And I
Yeah.
completely understand why. And
Yeah.
then they go to a conference that's for them, their conference that's clinician based, and they get advice, so-called advice from people, well-meaning possibly, that want them to make money, and they're there to help them make money, but they don't always know the compliant way to do so.
Right.
So they advise them on a certain way of doing things that is not compliant because they haven't even considered compliance because maybe that's not on their radar. They're just
Yeah.
trying to help someone else make money and that doesn't even enter their thought process. So
No.
the physician comes back to the office and says, we're going to start doing this. We're going to start doing this procedure. We're going to start making all this kind of money. We're going to buy this machine. It's going to make us all kinds of money. No, it's not, because you don't know the payer. And the
Right.
100%, like the toughest conversation I have with physicians is explaining to them the gap that exists between what you want to do and what you can get paid for. And
Wow.
so that is, I think in our industry, that is like the biggest challenge we have is
Right.
that communication gap between what a physician wants to do and what they can get paid for. And so
Yeah.
I think that is our dilemma, trying to explain that. So when we
Yeah.
talk about NCCI and we talk about documentation requirements,
Yeah. Yeah.
and the physician that I'm having trouble with right now, it's a matter of understanding what you want to put on paper to get you paid versus what is medically necessary.
Yeah. What's in
And
the
who
yeah.
decides that, right? And I know physicians have they have a huge problem with what the payers decide
Yeah.
is medically necessary
Yeah. And it's really interesting that we talk
versus
about
what they think.
yeah. And it's really interesting what how physicians or even departments, hospital departments, they have this great idea, right? They have, and we're gonna, and it's like, can you bill independently? Is this a hospital outpatient department? Do you have a medical director who's going to sign off on all of this? Well, no. Okay, so are you going to have a physician that's going to be in the suite? Well, okay. So you've spent all of this money to do this, and now you don't know how to bill? Okay, there's an issue here. I can't tell you how many conversations that I have come on the back end where they didn't ask all of these questions about how to be compliant, which payers, and it winds up being no return on investment because they can't do it, or they revamp everything because they didn't ask compliance before the idea was put into motion. So, if anybody who is part of an outpatient department who creates ideas or a department where they want to implement something new, engage a compliance person, a compliance representative, a compliance officer. So all of the return on investment that you're making up front is worth what you're doing in order to make the money, right? Because if you don't, you could find yourself in a situation where you're not able to bill, or you have to significantly, robustly replace staff or employ staff so that you can become compliant. You can't have a department and one person is doing everything. No. So you have to be mindful of all of that when you begin to think about new ways to make money. And I heard about, and now I want to put this into motion. Doesn't work that way. Mm-mm. So, I think at the end of the day, we have to be very clear about what steps you take in order to create a means of revenue and have compliance in play at all costs. Yeah, yeah. And you mentioned something earlier about the adapting the ability to adapt what other practices do. So when the other practices are coming into play, there's a way, and OIG mentions this, that there's a way for you to adapt another practices compliance policy, but you have to make it specific to what your practice is doing. So it has to be very, very clear that if you decide to adapt another policy, that you can put this into play for your practice and make it work for them, for you specifically, I should say.
100%. There we go. I am sorry, guys. I was having issues unmuting my mic, as you could probably tell. So Mr. Gabe's going to edit that out later. So, goodness. So I'm looking forward to talking next about something that it's a kind of an illustration. I love illustrations. I love to talk about how things connect to real life. So I thought about this illustration. We think about, you have a child and they're not getting direction, and maybe they're part of a dysfunctional family. I think we probably have seen some of those families, right? Where there's not a lot of communication. The parents don't really show a lot of affection to the child. They don't give them attention, and they don't give them rules, and they just run amok, right? And we know what kind of adults those children become. We've probably seen them in society, right? Mm-hmm. So we need to understand that same concept filters down into the business office type setting, where you have those in leadership, the parents that are supposed to be guiding the organization and communicating with their children, so to speak, their staff, and making sure they have what they need to be successful in the organization, or in life, as we call it. And so when they don't have what they need, they start to find other ways to keep themselves busy, and they'll do this, and they get in trouble, right? They don't have the structure in their life as a child. They find other ways to keep themselves busy, and it's not usually good. Same thing in the office. If they don't have structure and they don't have a way to go, they end up getting in trouble and getting your organization in trouble. It happens every day. So that's why, as the mama and the papa of the organization, the compliance officer and the manager, I call it, whoever you happen to be, the parents, you need to work together as a unit and make sure your staff has what they need to do their jobs, and they understand the implications. If my mom and Miss Christine Hall uses this illustration as well, if my mom or the compliance officer says, I need you to clean your room, I need you to make sure this gets done, I'm going to be back in a little bit to see how it's going, and they come back and it's still not done, they have to correct you. They have to discipline you. If it's part of parenting. Right. It's exactly. So you have to know that is, or you have to be accountable to everything that you do. And so I think when children don't have structure, when staff doesn't have structure, they will find other ways to keep themselves busy, and they will get in trouble.
Yes, absolutely. And there's one of my favorite movies, Kindergarten Cop, where,
oh my goodness,
yes, it's not a tumor, where they Arnold Schwarzenegger goes to the other teacher, and she says, turning your back on your kids is like turning your back on the ocean. You have to turn around,
my goodness,
see what's happening, because if you leave and you turn your back, you never know what's going to happen. So, and it's almost the same concept with compliance. You can't turn your back on it. You have to stay focused on it on all times. Once you veer away from it, that's when things go awry and anything could happen. So if you create that culture as a compliance officer and you're working with the office manager, then if you're both working together, in that motion, then it becomes a fluid process and a fluid response.
100%. And a lot of organizations, they just don't really know what they're doing wrong. And maybe they're not doing anything wrong, but it's the time they're spending doing those things where they can be more efficient. So they're not doing anything wrong, but it's the efficiency issue. So we have a great opportunity in the next couple of weeks to bring on a guest that I'm actually really looking forward to. So I'm looking forward to, one of our first bonus episodes of December is going to be with Mr. Preston Alexander, guys. I don't know if you know who Preston Alexander is, but he is the Taylor Swift of LinkedIn healthcare writing. And he has great insights on data and practice management. And so we're going to have him come on and talk about profitability, talking about what you're doing to make money and what you don't know you should be doing to make money. And that things that just simple things that practices can do when the insurance company is fighting them. There are opportunities that they have to improve in areas they're not even thinking of, and they're compliant still to do, but they're just not doing them.
Yeah. Oh yeah. 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 Like the interest on the claims, that's a big thing, and I worked on a case where it was all about interest on the claims, and it's all about when they actually receive a claim and when the claim is paid. And it's all contract driven. If they're not paid within 30 days, or whatever that contract specifies, then the insurance company is responsible for interest. If you have somebody that's watching that, that's a means of money, especially if there's a delay and there's no payment made and there's a long delay, that could be significant. And think about that multiplied by how many patients you have.
Exactly. And we're going to talk more about some of these insights at our compliance seminar. So I wanted to make sure everyone had the information to sign up. We have so many great things happening at this conference. It's going to have awesome CEUs. We are doing a lot of promotions right now for it. So right now, remember, you can get free access to this event. You won't get CEUs if you get the free version, but it's free information, guys. So use code free access at checkout. And then also, if you want to get CEUs, but you still want to get a little bit of a discount, you can until the 30th of November. So jump over there and grab your CEU option with CEU discount as your code at checkout. We want you to have incentive, but also, why do you need incentive to come to this conference? I mean, we have Betty Hovey, we have Susan Walbert, we have Maya Turner, we have me, guys. We have Sonal Patel, we have Christine Hall.
Yes.
We have Keisha Wilson.
Yes.
Guys, Rhonda Buckholz. I mean, like, I would pay $1,000 just to see her. No, I'm kidding. I mean, I love you, Rhonda, but I'm not going to pay $1,000. But no, I'm saying, like, I would pay a lot to see Rhonda once.
Yes.
Right? But
yes,
because I love her. I love Rhonda.
Yes. Yeah.
But I'm excited to hear her presentation. I'm excited to hear everyone's take on compliance, because all of us as a whole, we are working diligently as compliance consultants around the country with different entities trying to make a difference. And so you're going to get all of us in one room for the day virtually.
Yeah.
Ask us anything you want, guys. Anything you want. And we do have a surprise guest that I will not be announcing live, guys. You're going to have to come to the conference to meet this amazing compliance physician that I have coming to the conference at lunch. So you're going to want to come to the conference so you can talk to him. So stay tuned for that. And we look forward to more information coming up next week. Now, as you know, we covered elements 2 and 3 today on the compliance officer and training. So we're going to move along to element number 4 next week. So stay tuned for that. We're going to talk more about compliance next week. So we will see you then, guys. Have a great week.